Hey everyone, Dr. Opperman here from Simplicity Health Direct Primary Care. I wanted to talk to you guys about coronavirus and going back to school. Boy, has this become a controversial topic today. There are people that think we should send the kids back to school, no mask, let's keep the economy going, let's go back to normal life. That has its merits and that has its downsides. There are people that say we should keep the kids out of school. Let's not send them back to school. Let's try to curb this until we can get a vaccine. Let's try to save as many lives as humanly possible. And that has its merits and that has its faults. Right now, I think most people's plan is let's send people back to school. Let's put the masks on. Let's try to keep them 6 feet apart. And let's try to curb the spread while we wait for the vaccine. That's a middle ground, and I am usually all for the middle ground. I always think that the middle ground is where it's at. However, this time I'm not so sure. The problem I see is that if we send all the kids back to school in August or September, I'm afraid that we're going to get a large surge of cases in October. I'm hoping that maybe the virulence of the virus has gone down and the spread of it has gone up, which means that if you're not feeling like you're on your deathbed, you're more likely to go to Target, to Kroger, to Walmart. If you have a mild cough, a sore throat, or you're asymptomatic, meaning that you'll spread the disease easier, spread the virus easier. But if you're really, really sick or the virus is very, very lethal, then you're more likely to social distance just by nature. You don't feel like going to Kroger or Target when you feel like you're about ready to die. You'll stay home. And by doing that, you decrease the spread of the virus. And so through natural selection, I think that the virus may be mutating or may have mutated. And that's my hope, that the virus has mutated to something that we call less virulent. A virus that's more likely to spread but is less likely to cause death and hospitalization. So maybe that explains some of the disparity that we see between our death numbers and the surge in cases. So the problem though is if we send the kids back to school, I'm afraid we're going to have a rapid number of surging cases in October, and then just by sheer number we might still have a less virulent virus, less likely to kill you. But still, nonetheless, there are going to be people that get hospitalized, get very sick, and people that ultimately die from this. And I'm concerned about the sheer number of those cases overwhelming our hospital system, the whole point of us flattening the curve. So what is the right answer? For me, I think the right answer, and it may not be a popular one, but I think the right answer might be, let's keep the kids home from school for maybe 9 weeks, maybe a semester, and do online schooling, or if we even have to cancel school. I don't know what the right answer there is. I'm not an educator. But the benefit of that is it buys us time until we can get a vaccine. So by all accounts, there's a lot of really good vaccines out right now that have started phase 3 trials that look like they're going to work. And it looks like we might actually have them available for mass distribution by early next year. What has happened is the government has actually made a really big bet, and they bought a bunch of these vaccines before they've even been proven to work. Basically, usually what happens is the vaccine has to go through all the trials, make sure it's safe, make sure it works, and then they mass produce the vaccines. However, we've already been mass producing these vaccines in the hopes that it'll work. Basically, a bet that we're making without having evidence. Maybe we would end up wasting our money if the vaccine didn't work. But the good news is it's looking like it actually is going to work, and there's a lot of good data published in clinical trials and in the scientific journals that looks like we will get a vaccine. So it's really a race to the vaccine. So if we keep the kids at home for the first semester or 9 weeks of school, that gets us to maybe November. And by that point in time, maybe we'll have a better chance to get more immunity within our community through vaccination. Then you might say, well, not everybody's going to take the vaccine. And that's true. But that's okay, because the people that do take the vaccine will increase the herd immunity throughout. And if you choose not to take the vaccine, that's ultimately your choice anyhow. And I guess my expectation and yours should be too, if you get sick from not taking a vaccine, then I guess you're the only one to blame for that. So anyhow, if we send the kids back in October or in September and October like we're planning to do, I guess August or September like we're planning to do, my concern is that it's going to spread. We can try to keep these kids social distance. We can try to give them masks, but I have a 5-year-old at home, and I bet I tell him 35 times a day to get your finger out of your nose. Kids will pick their nose, they will have snotty noses, they will touch things. The lovebird teenagers will find a way to get together and kiss or whatever they're going to do. When we send the kids back to school, you can watch this thing spread. If you think it's spreading right now, just wait until we send them back to school. Now, hopefully, I think that's the plan anyhow, but hopefully it's not as virulent and this thing spreads like crazy and everybody turns out okay. That would be a best case scenario. Right now, we have 4.3 million cases of coronavirus in the United States. We have 325 million people in the United States, or it's about 1% of the United States has been affected with coronavirus. If you really think about it, there's a lot of not testing earlier, maybe there's asymptomatic people, so I'm guessing that maybe there's probably double that number of cases that we've actually had, or 8.6 million cases. That gives us about a 2.5% rate of coronavirus in the population. We think that we need 68 to 70% to get herd immunity. The issue becomes, it sounds like it's going to take forever for us to get there, but the more and more people that get coronavirus, it's not a linear relationship. It's an exponential relationship. So each person that gets infected can spread it to 3, 4, 5, 6 more other people, and it tends to grow exponentially. So I think that we're setting ourselves up for a major boom in cases, especially in the fall. Now, I kind of gave you my opinion. I think maybe we should stay home for the first few weeks of school, and hopefully that buys us time to get a vaccine. I'm not sure if that's right or not. We're all entitled to have our opinions, and we're all entitled to be wrong. I think we all want the best for us. We're all trying to make the best decisions that we can, and that leads me to my final point. I think we should all have more grace with our leaders, whether that's being the leaders of the government, leaders of our state government, our federal government, whether that's being leaders of the school, whether that's being the leaders of your church, whether that's being the leaders of your organization or your employer. Again, we're all trying to make the best choices with the information that we have at hand. And I don't think that anyone knows the right answer. So if the governor came out and said, everyone wear masks, you're going to upset some people. If the governor came out and said, no one wear masks, some people are going to be happy and some people are going to be upset. Everybody's going to be upset. Some people are going to be upset no matter what. So I urge you to put yourself in the governor's shoes, or I urge you to put yourself in the president's shoes, or the church leader's shoes, or the school official's shoes. There's no great answers here. This thing stinks, and all the answers are bad answers. We're trying to do the best with what we can, and so I think we should try to have some grace with our leadership and just realize that they're trying to make the best choices that they can make. I don't agree with all the leadership decisions. I don't agree with the federal government decisions. I don't agree with the state government decisions. I don't agree with the school leader. There's going to be decisions that I don't agree with, but I understand they're trying to make the best choices with the information that they have. And I think that's the best we can do, and just have grace with our leaders, have grace with each other, try to get through this. And the slogan is, we're all in this together, but sometimes we don't act that way. And I really encourage you or urge you to try to get in this together with each other. Let's follow the advice of our leaders, knowing that they're trying to help us the best way that they can. And maybe it's not going to be popular, maybe it's not what we like or what we would do, but still they should be respected. They're authority figures, and they're trying to do the best with what they've been given. So anyhow, that's what I have for today. That's my information on schools and what I think we should do. If you have any questions, comments, please be respectful in the comments, and let's have some civilized conversation, and we talk about what your opinions, what your ideas might be. I'd love to hear them. That's all I have. Again, Dr. Opperman from Simplicity Health. Have a great day.